And the last OBGYN physician that I was supposed to meet with was part of the practice in the group that I saw when I was pregnant. So she walked in the door when I was delivering my son, and we laughed about how the fact we'd never been able to set up an interview before that. And I said, well, ask me now. And she was like, no, you're giving birth. And I was like, well, we're both here. We might as well. I don't know, maybe that's why I got the job.
Karmi Soder is your last name, right? Soder.
Correct. Mm-hmm. Means
welcome.
South in Swedish.
Welcome to PedChat.
So basically, this is the camera. The good news is you don't have to buy the camera and then have a piece of equipment that you're stuck with and maybe you use or don't use it. You're actually renting the camera. We do a 14-day sleep assessment. So it goes up on the wall just like this over the child's bed, about 3 to 5 feet above them. And what these guys have done inside this camera is amazing. So it takes about a day or two to learn the child's breathing pattern. And then it will record when the child is asleep. And you can actually see the rhythm and the pattern. It looks almost like a ribbon of their breathing. So it helps to tell you about the quantity, how much sleep is a child getting. There's also an iPhone app where families can follow along and see all of the information that's being gathered. It also tells you about the quality of the breathing. So what percentage of it is in really a deep sleep? What percentage is more of that restless sleep? You get to learn a lot about routines. It's so important going to bed at the same time, even on weekends, and waking up at the same time. We as adults know this, but don't always do it. So yeah, so you get the sleep assessment, and then it gives you recommendations and things of what to do differently. And then families really, a lot of the times, keep the camera. They can rent it for as low as $10 a month. And you get an updated report of what's changed. So if you're doing things like environmentally wise, whether it's about the temperature of the room or blackout blinds or allergies or different interventions and things that you're doing differently, you can make those changes and then see what results from it. So yeah, it's really helped an amazing amount of families, especially those who struggle with behavioral issues. Whether they're on the spectrum with autism or they have ADD or ADHD, those families really, doing a hospital-based sleep study where you attach all the electrodes and leads to your head. You're in a foreign place to try and sleep. Very hard for families. How do families do that when you have other kids at home? It's not restful for us as adults doing it. That's why in-home assessments for adults have become so popular. There's nothing out there that we know of that's for kids. And we really started out with kids because it's harder. They actually have measurement points from the tip of the head, top of the skull, the tip of the spinal cord down to the base of the spinal cord, and that's what measures your thoracic and abdominal movements. And so that's what can tell you about the breathing. And it's harder in kids. Kids move around more when they sleep. They're active, they're smaller. So the idea was if we could help families and children, then we can roll out and help adults.
So you have a history in operations, a lot of experience in operations, and most of our viewers are going to be pediatricians. Mm-hmm. And I'm starting to get a sense that the private practice world is getting tougher and tougher, not only from a margin standpoint, but from a general operations standpoint. Mm-hmm. I guess one could lead to the other. What are 3 things that you can tell the private practice pediatrician, private practice owner right now that could transform their company in 3 months?
Oh gosh, boy, if I could do that, that would be wonderful. I think some of it is kind of what I said before about relationships. I think healthcare is broken. We all agree that the payment structure around healthcare just doesn't work. The average pediatrician has, I'm going to say pediatric visit, because whether it's a nurse practitioner or a pediatrician, has between 7 to 12 minutes to spend on a well-child visit. That's hard. That's not something a pediatric provider wants. That's not something that they necessarily signed up for. It's kind of like how healthcare has changed. What we're able to provide. There's kind of the joke about, hey, I want to provide this care, but I've got to check with the insurance to make sure it's allowed and it's okay. It's true. We have to do that. And I think it's easy to forget how much families value and trust and respect their pediatrician. It's such an important role. It's someone that you see as your child is growing. You really trust them with this most precious thing, their child. And so it's a wonderful relationship. I mean, so much of it is built on that knitting and weaving together of, no pun intended, of relationships. And the same goes with the staff. A staff, not anybody works in a pediatrician's office. It takes a special kind of person to work there. Someone who's really interested, vested. Days can be hard and frustrating on the phone with insurance companies or triaging calls. And I think sometimes we just forget how important relationships are. So whether it's a pat on the back and saying to someone, hey, they're doing a great job, everybody needs that, I think. We're all human. So whether you're the owner of the practice, maybe the staff needs to give that to the pediatrician and vice versa. A lot of it is just respecting that relationship and valuing each other. I think we can easily forget that in the day-to-day frustrations of seeing patients all day. I also think that there's an acknowledgement of why we went into this. It's easy to forget that when you've been on call or you're tired or things haven't gone as well as you wanted to in a day. There's a reason. These are very special people that go into healthcare. It's kind of, think of a funnel and taking it down. There's a reason that people go into healthcare, and then even more of a reason that people go into pediatrics. And so kind of finding that in yourself, whether you're the provider or someone working in the office, to say this is just really making a difference to these families' lives. And it may be the 10th, 100th call you've taken that day or person that you've seen face to face. But for them and that patient, it's their first experience and their first encounter. So respecting the relationship between each other, respecting the relationship of the patient. And then other things that I like to do is ask people what's working well and what's something we should do more of and what's something that's not working. I know when I started at CPMC, we did a funny thing called the POOF rule. And it was just taking something and making it go poof, because there was a lot of rules and regulations and things that you had to do, and some for a very legitimate reason, but other things it's just kind of, oh, this is the way we've always done it. I don't know why we've never thought of doing it differently. So being innovative, and sometimes you have to be innovative in a very small, tight, compacted rule box, and sometimes you can really look outside the box and think differently, and try to rely on each other. Someone who does the same thing every day, all day long, is going to give you really good advice about what could be done differently and what works well that they're doing. And that's kind of something I always like to do, especially starting at a new position, and something that I've tried to do here at KNIT, to say, like, what's working well? Don't be a bulldozer and go in and just bulldoze everything and say, hey, it's got to be my way. But really respect and learn from everybody's roles.
Yeah, well, thank you for that. So do you remember a tangible example of something that you went poof with, if that's the right way to say it?
Oh, yeah, that is exactly. And you have to do the hand motion too.
Right.
You did a good job of the poof. I do. And it's kind of an amazing story. And I can't believe I'm going to tell it to you, but it's good. So when we would have rooms on the pediatric unit that were not in use and there were no patients in there, no patients that were in the room, there was a way, it was a push button door. So you had to push the door open to the room. So in order to lock the room, you had to take this big, thick chain, almost like a big bike chain, and wrap it around the door handle and lock it with a padlock. So the unit was divided into two kind of horseshoe shaped units. So you would walk through them, and the first place you would walk was you're walking onto the pediatric unit. You would look around and all you would see are these huge chains and locks. It was pretty intimidating. I mean, even a zoo doesn't have this kind of locks. And you're walking through a pediatric unit. And as I was walking through, I thought, it looks like we're chaining patients and locking them in their room, because you don't know that the room's empty. And so the nurses said, oh yeah, it looks awful. Parents comment it on all the time, and they say it looks so frightening. And this poor child, it's right at about eye level is where the lock is. So that's right about where you see the chain. So I said, well, why are the rooms locked? Why are we doing this? I don't know. We've always done it this way. This is always something. They've always been locked. So you kind of have to peel apart the onion to find out, okay, who set the rule? Why is it doing it? Well, it ended up where somebody thought that the beds were going to be used, and if they weren't in use, that people would lay down in the beds, the linens would become dirty, and people would then have to, so we just put a sign. We took all the chains off the door, and we put a sign on the bed saying, you know, please save this for a family. A family might need this in the middle of the night. So it wasn't, if you went to go walk in the room, you saw the sign on the bed and thought, oh, I'm not going to, you know, I don't really know who sleeps in a hospital, but I'm not going to go sleep in this. Maybe if they're taking their break or something, I'm not going to go take my break in this room because maybe it'll be used for a family. And then all the chains and the locks were gone. And it was great because a lot of times it's that what's referred to as low-hanging fruit that just makes such a difference. When you ask a nurse or somebody, you know, what's not working well, and it's like, gosh, all these chains are so frightening, and then you get rid of them, and you go back to them again. You say, okay, let's do something else together now. Give me you know, what's the next thing we can tackle? And so the next thing we tackled, which one more quick story, was we had this big blank wall in hospitals. There's always these big, long blank walls. And it led back to the playroom, which was this beautiful playroom with skylights. And kids would go back there. We actually wanted them to take their IV poles, get out of bed, ambulate, go back to the playroom, but there wasn't anything drawing them back there. Visual clutter with too much signage and different things that didn't really make a lot of sense. So we painted a mural, and we had art students there's nothing that an artist wants more than a big blank slate where they can create what they want to create. And so we created this wonderful mural that we painted on the wall that really drew patients back. And as it was hard to ambulate and walk far back there, you could stop and look at the mural. And there was enough engaging, interesting things in the mural. It was of San Francisco and a lot of different well-known places in San Francisco. And so you could walk back and enjoy the mural as you were walking back. And actually one of the art students that painted the mural worked just amazing hours and doing so much work. It was philanthropically funded. We had raised money for it. And she actually became a child life specialist. And she's still working at CPMC now in the emergency department as a child life specialist. So
that's awesome. Well, contextually, this is really awesome because you've got communicate and you've got ask questions, which is also communication. So you can develop this correlated system. I hope there are a lot of pediatricians that are listening to this and they're looking at the numbers, they're looking at their spreadsheet, and they got into this, as you said, to hold patient care in the highest of values, right? You don't become, I love your funnel analogy, you don't become a pediatrician to make a lot of money. Let's just put it that way. Let's throw it out there. You become a pediatrician because you really care, but you still need to make enough money to keep your company afloat. Right. And I think if you value culture and communication and you just ask questions and fix the low-hanging fruit stuff, that would be a great start, a great turning point. If you're any pediatrician out there, listen to Karmi. She knows what's up.
And though the other thing I love is the magic wand. So sometimes we need an icebreaker to be able to talk to people about this, because if you walked up to some people and just said, hey, what can I do to make your life better? They'd be like, I don't know. Well, you're scaring me. Stop asking.
I haven't talked to you in months. Why are you asking me questions?
Please, why are you talking to me? But if you can think of the magic wand and say, if you had a magic wand and you could start with one thing. You could just change one thing. What would it be? And sometimes it's a big thing and it's not able to be done. It just feels insurmountable. So you say, okay, now let's shrink the magic wand and make it something. What's one thing you can do today? What's one thing you can do today that makes your day better and different? Because I guarantee you, if you change it for one person that's a staff in your office, it will make a difference for the next patient that they see. They won't just become a number. They'll use their name, they'll smile, they'll talk to them, they'll feel better about the job that they're doing. And it becomes contagious, and they'll do it to the person that's sitting next to them, and all of a sudden you just have this different feeling in the office.
So book recommendation. I'm asking everybody what book they recommend.
Let's see. I got to think about this one. I'm going to answer the question. You may not like this answer. So if you decide to edit it out, I'm good with that. I worked with a philanthropic organization called the Reading Tree. And the Reading Tree would write a prescription for reading and tell parents, read to your child 20 minutes a day. And the pediatrician would actually write it down and then give the child a book. And it was gently used books. They would do book drives. The Reading Tree did book drives from schools and different places. So I'm going to spin it a little bit and say the books that I would recommend for pediatricians are having books in their office. If you can do some type of book drive for kids, I think we've gotten so technology focused. You know, I read articles. Yes, I read books, but I read a lot of articles and a lot of short, because our attention span is so much shorter. But if we can get reading back into kids, and if you can put books in your office, even ask your staff, if they have children, start a book exchange. I mean, I loved it when I went on vacation and I saw this little mailbox outside of someone's home at the beach, and it had all of these books, and it was like the give one, take one, or when you do a rental at the beach, it's always at the beach, I guess, because that's when you have the time to read.
Yeah.
But where you can do like a give one, take one for kids' books. I think we need to get parents reading to their kids again. And it's not necessarily a socioeconomic thing. You know, you think that technology can replace that, or a computer game can replace it. I love reading to my kids. My kids are older now, but when they were little, I read to them, and we were fortunate enough to have great books. There's a kid's book that I reference a lot called How Are You Peeling? And it's Peeling, like peel a fruit. And it's all of these different kind of ugly fruits. It's a orange that looks like it's mad. It's a red bell pepper that looks like it's really happy. And it's all these different things, and it's talking to kids about their feelings. So my answer is going to be to getting kids to read.
All right. I love it. I love the reversal there. Yeah. No.
Turn the question
I'm not going to, any book is allowed on the show.
Okay. I have other ones. I read a lot of Quint Studer books, The 7 Habits of Highly Effective People. And yeah, but I would think reading to kids.
So what is one productivity hack that you've implemented in your life in the past, let's say 2 to 3 months, that's really changed the game for you?
Well, one of the things that I really like that we used at Getswell was messaging and being able, again, to my theory of communication. Slack is a free app that a lot of startups use.
Whoa, you use Slack at Getswell?
I did.
That is cool. Because, you know, I'm the startup guy. I love Slack.
I love Slack. Now, sometimes you can over Slack. It becomes a verb, like Googling things becomes a verb. You have to be careful with, you know, patient information. But it improves communication or some kind of instant messaging because you can do it on your computer. And it was helpful because it got, especially when we had 2 locations and 2 different offices, it got people talking to each other and communicating. And I absolutely think that pediatric offices can use Slack because it improves the communication. People always say, oh, but what about HIPAA? What about HIPAA? So you have to implement it in a way that works for you. But yeah, I think it's a great way, or find some kind of instant message. There are some healthcare startups that are doing similar kind of implementing. The other thing we did was really give people the tools and systems that they need to be able to do their job. So when I started at Getswell, we had an electronic health record that everybody just loathed. I mean, it was just not one, I won't say the name, but it was not one that people liked at all. And the one that we fell in love with was funny because it's called Elation. So we joked and said everybody's elated. So elated to be on Elation, and it paired up with an amazing payment system. It was a membership-based practice, direct primary care practice. So we worked with Hint Health, and that was our payment arm. And so what it did was really streamline operations, but that happened from talking to people and asking people, what's working well. And you'd hear people just grumbling and complaining, and systems that we had in place before we had those two systems, which just didn't work for people. They were too labor intensive. So when you fixed it and solved the problem, people had more time to smile at patients and work smarter, better.
So I'd love for you to tell me the 5+ minute version of what got you into medicine that you told me, and how you went through the pediatric practice world, and you worked with some enterprises, and then what eventually led you to work with NIT, and even before that, be an entrepreneur with another company as well. So if you can give me that 5-minute synopsis, that would be awesome.
Sure. So I knew always since I was about 10 years old that I wanted to be a pediatrician. It was my dream, love kids, kind of structured my life around doing that and being able to do that. So I went to Georgetown undergrad, and I met a woman who was a nurse practitioner, and she was just this beam of light. She had done so much. Her story was amazing. And I wish I could get in contact with her and tell her how she changed my life, because it was that moment when I really decided this is what I want to do. So I finished at Georgetown and loved it. Great experience. Moved to Manhattan. And I worked in the pediatric critical care unit. And I went to nurse practitioner school in Philadelphia. I went to University of Pennsylvania. And then after graduating, I moved back to Dallas, where I'm from, and opened up a clinic for women and children. So then after that, I moved back to Philadelphia, worked with an early Head Start group. It was from birth to 3, and really focusing on the healthcare for these pregnant and parenting teens in Center City, Philadelphia. We opened up a clinic that was several bus stops away from where the patients lived. So we redesigned the program to be a home visiting program. What we found was if you really had that relationship and that trust, which is what pediatricians are so amazing at building with their families. And I think some of the solutions that have entered the workplace have affected and impacted that relationship. That's what a lot of pediatric care is about. And I'm in San Francisco now, and I worked for California Pacific Medical Center. I was there for a couple of years while I had my 2 kids. And when I was about 7 months pregnant with my son, my dream job became available. It was the Vice President of Women and Children's Services and the Chief Administrative Officer of one of the campuses. And I got the job after 36 interviews, the last of which I was in labor delivering my son.
Wait, 36? That's real?
36 interviews. Oh, I met with 36 people. It was amazing.
Oh my gosh.
And the last OBGYN physician that I was supposed to meet with was part of the practice and the group that I saw when I was pregnant. So she walked in the door when I was delivering my son, and we laughed about how the fact we'd never been able to set up an interview before that. And I said, well, ask me now. And she was like, no, you're giving birth. And I was like, well, we're both here. We might as well. Maybe that's why I got the job. I left and did a brief stint with Kaiser. And then I opened up my own company, and it was wonderful. We impacted a lot of families, helped a lot of people. One of the places we taught CPR was a very innovative practice in San Francisco called Getzwell, and Julia Getzelman started the practice about 10 years ago. She needed help with running operations for her practice. So I was fortunate enough to be with her for about 3 years. And when I was at Getzwell, kind of one thing always leads to another. 2 wonderful gentlemen came in to tell me about NIT Health.
So what's in store for the future? Are you just going to grow NIT? Is that it?
Yeah. I'm really blown away. It's a great story to tell, because I can tell people I left the practice that I was at. I wasn't looking to leave, but I left because I was blown away with the service and the technology that NIT offers. It's amazing to me, and we have a story to tell, and we need to get the word out there about the product and what it does. And we're telling the story through families that are just thrilled. They really were at their wits' end. Sleep is a hard thing to be able to look at and find out what's going on. I think there's a lot of parents out there that have crept into their child's room and the door creaks and you can't see, and you try to videotape something and it's too dark. I mean, the videos from this are just amazing. And you can actually see when a child is retracting and having difficulty breathing. It's nothing like it I've ever seen before. So I was so blown away that I left to work with them. So yeah, for a while, I hope to be here. I do some advising to different companies. There's a great company out there called Incredible Health. And it's incrediblehq.com, and they match hospitals and nurses to decrease the length of time it takes to hire a new nurse. And they contract with hospitals right now. They're in the Bay Area. But it just makes so much sense because it takes a long time, and pediatricians know how long it takes to hire a nurse. They'll eventually go out into private practices. Right now they're working with hospitals, and I'm helping advise them. I'm working with another company called Birth Buddy, and it's a device when you have a child, people tell you to push, but not like you're pooping. And everyone's like, I've gone to all these healthcare, all these classes, all these things to learn how to have a baby, and I have no idea. But if you hold on to something and you pull up, it engages the correct abdominal message. I can see you're trying to do it, and you pull up.
Yeah,
it engages those right muscles. So if you hold on to something and pull, you engage those upper muscles. Mm-hmm. So that's what this device does. It looks like a large silicone stretchy toy, and either your partner can hold one in, or a nurse, or it wraps around the bed frame, and so you pull up and it helps you to bear down and give birth.
So I have one more question for you.
Sure.
If you could tell your 25-year-old self something, what would it be?
That's a good question. Okay, 25. Enjoy the ride. Enjoy the ride. There's going to be a lot of ups and downs. Sometimes you don't know if it's good news or bad news at the time. And some things that happen, you think, oh, this is just not good. But then it leads to something different, which is amazing. So I think if you can it's not sit back and enjoy the ride, because I think you have to be more in the driver's seat. At least I do. Maybe that's just my personality type. But enjoy the ride. There's a lot of ups and downs, and this is the only chance we get. So I want to make a difference, and I want to impact lives of children and families. And when I look back at my 25-year-old self, which of course was just last week, I've enjoyed the ride. I've really liked, and I've had lots of different challenges and ups and downs that have been really upsetting, exhausting, frustrating, devastating. But you learn something from everything. So if you can just sit back and enjoy the ride, no, not sit back, be in the driver's seat, but enjoy the ride. Because
enjoy the drive.
Oh, that's good, Zach. Ooh, enjoy the drive. Yeah, there you go. I like it.
Well, I think what you're talking about is a mindset thing, where it's how you think about the downtimes, and you don't think about it and get depressed. You think about it and say, oh, wow, this is a learning opportunity, right? Mm-hmm. Getting into something different is a learning opportunity. Expanding your knowledge here is a learning opportunity. A lot of at least for me, a lot of those valleys have been the times where I've learned the most in life, and I come out even smarter and better the other side.
Yes.
Right?
Yes. And you don't always realize it at the time. And then you come out of it and you think, wow, I learned a lot from that, whether it's about yourself and your own way of looking at things, or others, or what you want to do next, what the next challenge is. There's a lot of different opportunities out there. So fun.
Love it. Well, thank you so much. Yeah, thank you so much for being a part of PedChat. Karmi Soder, entrepreneur, nurse practitioner, awesome parent, mom. Thank you. You've been amazing. I think you'll inspire so many people. I'm looking forward to editing this and getting it out there.
Thank you. I appreciate it.